Hi, everyone. Good morning. Today, we're joined by Dr. Mark Briesacher, Intermountain Healthcare's Chief Physician Executive, to give our COVID-19 update for the community. Mark, nice to see you. Thanks so much for joining us.
Good to see you, Amanda. Thanks for having me.
Of course. So as always, I'd like to start with our case trends and go over what Intermountain and the state of Utah has been experiencing since the last time we spoke. Our total case counts in the state of Utah are at 358,581, and yesterday's daily case count was 1,242, which brings our 7-day rolling average positive percentage to 14.8%. Our death total in the state of Utah is 1,774, and yesterday there was 9 reported deaths. Our hospitalizations are at 14,054, and yesterday's total was 327. And our vaccinations are at 462,720, which is more than our case counts, which is awesome. Let's break that down a little bit. Can you talk to us about what this downward trend of case counts and percentages could possibly mean?
So it actually means something really important. That is the immunity or immune status of people who are protected against COVID-19, either by having the vaccine or the virus previously or being vaccinated, is increasing at a very quick rate. This is just so important because it just reduces the number of people who are susceptible to getting sick if they are exposed. And of course, I also think it speaks to the continued commitment of members in the community to do the basics, right? Socially distance, hand washing, wearing a mask, and even double masking now, which is something that's been prominent in messaging from the CDC, from the Utah Department of Health, and something we support.
You mentioned that this is a good thing for us. How are our hospitals and the atmospheres in them right now? Are our caregivers feeling a little bit more relief as these numbers seem to go down?
You know, they are. I guess I would characterize our caregivers as being very resilient in the context of the pandemic overall, and to be at this point where the number of admissions is decreasing, the number of critical care beds that are needed is coming down for COVID. This is just a really good thing, and I think that creates optimism, creates hope, makes everyone feel good. And I think the community can count on us to be there for them, whether they have needs of COVID or any other healthcare condition. And our teams, our physicians and nurses, the pharmacists, they'll be ready for that.
Last weekend, too, was also the Super Bowl, which is typically a event where people gather, and it doesn't seem to say, at least the case trends, that anything increased from that, which is great to hear. It seems like people are really adhering to public health measures and making sure that they're keeping themselves safe. Do you feel like the number of vaccinations that we've given out could also contribute to the fact that our case trends are starting to go down as well?
Absolutely. I would note that it might be just a little bit early for us to see the impact of any large gatherings that took place on Sunday. So we'll be watching closely over the weekend and through the first part of next week. But I'll go back to, Amanda, what we talked about earlier. It's the combination of growing immunity, the growing protection, ideally achieved through vaccination, but we know also it occurs when people do get sick and recover. As that percentage increases in our community, I and the analytics around the predictive modeling all show that we will continue to have a decrease in cases.
Which is great news. And I think this next question is really important too. Somebody wants to know, looking ahead to a year from now, when we can hopefully hope that this pandemic is behind us, what are some practices in healthcare that we're going to continue to do after the pandemic? And what are some of the biggest lessons that we've learned during COVID-19?
So it's a great question. And I'll actually answer what are the practices that both in healthcare and as a community we should do. I was thinking about, how often did my mom and my grandma tell me, wash your hands, cover your mouth, cover your face. I think we need to continue to do that even beyond the pandemic. There was a really nice thread on Twitter this week about the fact that we are not seeing influenza. We are not seeing respiratory syncytial virus, winter surges, and many other viruses that affect both adults and kids. And that is due to the fact that we are more consciously competent. Like, we think about, listen, I'm going to wash my hands. I'm going to use hand sanitizer. I'm going to the store. Yeah, I'll just go ahead. I'm going to throw on a mask. This is what we do. So you can count on us in healthcare to be doing all the things that we do each and every day to keep people safe from both COVID-19 and other infectious diseases. And I'd ask the community to really think strongly about what are these practices that are going to continue going forward.
I think it's interesting you brought up the hand sanitizer part. I feel like that's never going to leave my car now. It feels like something I just have kind of brought into my routine after going to the grocery store. And you also talked about the community aspect of that. I think this has really allowed us as employees to kind of say to myself, am I sick? Should I be going into the office right now? It's definitely reduced the amount of spread. And I know personally, I'm usually having a cold sometimes during the winter, and I haven't at all this year. So that's a really great thing going forward that I hope people keep in mind as we kind of move through the pandemic.
Yeah, I think in the HR world, this is called presenteeism, where when you're sick, you still are present at work. So I completely agree, Amanda, the growth in technology that allows people to do work remotely is great. And it's also important to keep in mind that there are people who don't have that ability. They have to go to work every day and be on site. On the construction site, we can, list many roles. And so it's important that we as a community, as business leaders, we continue to think about what are the things we can do to keep our workforce safe as we head out of the pandemic and into the future.
I want to talk about something that we announced last night. We, Intermountains, announced that we're supporting the preparation to expand COVID-19 vaccinations for more Utahns. Can you give us the details on what exactly that means from our perspective?
Yeah, thanks. I'm really excited about this. We are part of a coalition of providers that'll be working together to expand the number of places that people in the community can get their COVID-19 shot. We'll be adding 9 high throughput, so places that can do 1,000 vaccinations a day or more. We'll be adding 9 sites across the state from Logan to St. George, and join local health districts, Utah Department of Health, and the other partners in the coalition in increasing the access. I think the most important, the most exciting part of this, Amanda, is that we actually can do this, right? The vaccine supply has increased that allows us to join in now in the vaccination of people in the community. And of course, a big part of this is, the announcement last week, and something that we support completely, the expansion of those who are eligible. So, the Utah Department of Health has announced that on March 1st. People 65 years and older become eligible as well, and this is important. People who have certain chronic medical conditions, they also become eligible. Oh, let me add one thing, Amanda. In addition to the 9, we're also adding a handful of drive-through locations, and these are going to be located in the more rural areas of the state. So this is, we have to always keep in mind, how do we vaccinate everybody across the state, not just in the major population centers, but all Utahns who live as well in rural settings. We want to make it as easy for them as well, so they don't have to drive 2 and 3 hours to get a shot. They will be able to drive to other locations.
I think that's really important. If you bring the vaccines to someone, it allows them the opportunity to actually decide if they want it or not, as opposed to, like you just mentioned, having to drive those 3 hours. Can you explain what high throughput means a little bit more? What does that specific term mean for someone who maybe is not as familiar with it?
Right, thanks. What it essentially means is these are sites that have the capacity to do 1,000 or more vaccinations per day. So that's the high throughput. So The ask from our state leaders were to focus on creating experiences, creating the operational setup to be able to deliver on this. So, for example, we understand how many kind of greeters and flow, people staff that need to be in place to help just everyone flow through the process. We understand how many people we need each hour giving vaccines. And so that's all mapped out, and we're going to be ready to go that first part of March.
You mentioned the eligibility for the first part of March being that 65 and over and some certain serious medical conditions. How can people find out if they fit within that serious medical condition category?
So there's a great place on the Utah Department of Health webpage that lists out these conditions. And I think it's the other obvious place for me is call your primary care physician, and they certainly can help as well. And I think it'll be pretty self-explanatory, but I also know there'll be conditions. So I guess just keep asking questions of those around you to help get the clarity on, are you eligible or not?
And we'll put the link for that specific website into the Facebook Live afterwards. But along those lines too, you mentioned talking to your care provider. I think it's also important if someone has questions around maybe their specific condition and they're not sure if the vaccine is right for them at this time, to talk to their doctor, have a conversation, ask questions. Asking questions is the only way to learn more right now. So I think that's really important. If you have any hesitations or questions, your primary care provider knows your medical history really well, and they're going to be able to answer those questions the best for you specifically.
And Amanda, I'll add one other thing, and this is a common thread amongst the healthcare providers that are part of the coalition. We are preparing to reach out to patients who are at higher risk, and we'll contact them through our electronic health record portal. We will call them. We have a workforce of care managers who really help our patients who have really complex disease. We help them in all sorts of ways in terms of remembering to take their medicines, being available to answer questions so they don't have to go to the emergency room, monitoring them remotely in many different ways in terms of whether it's glucose or oxygen saturations and other things. So we'll be using our caregivers who do this work every day and help guide our highest risk patients through that process.
Another thing I wanted to talk about, and a question we just got, was around our Utah Valley Hospital clinic for vaccinations that we hosted yesterday, and it's still going on today. We opened up the availability or the eligibility for this clinic to those who do not live in Utah County but are over 70 or meet a couple of other criteria: healthcare worker, K through 12 educator. Do you feel like we could potentially move up that March 1st date if we keep running into these situations where people are not filling the appointment slots that we have available?
I think everyone involved in the work, from the state to all the partners in the coalition, we want to get going as soon as possible. There are a number of variables that impact when you can get started. Even today, we've gotten the announcements from the federal government about when we would expect vaccines, and we also know that we have to see that happen. So I guess the bottom line is we want to start vaccinating more people as described as soon as we can. And if that can happen a half a week earlier or a week earlier, that would be great. I just want to be realistic about all the variables from a logistics perspective and a staffing perspective and just running the clinics every day. There's a lot of work to be done there, and we're heads down getting that done. And we want to be ready to go so we serve people really well.
Along that same line too, do you feel like on the trajectory we currently are at, that we will be able to vaccinate everyone who wants a vaccine by the end of May? This was mentioned in a couple of press conferences over the last couple of weeks that that's the goal. Do you feel like we are going to be able to do that?
So based on what has been predicted in terms of supply, and as a state crunches numbers, I have confidence in that end of May. But I also know, and I think we've learned this time and again through the pandemic, things change. So, boy, I guess what we tell our teams is let's be bold. Let's reach as far as we can reach to do as much as we can. And we know things will change and affect the pace at which this happens. We hope those are all positive, but we're realistic. We know that there are some things that change that impact it in a negative way. We'll roll with the punches, learn from it, and keep moving forward.
You mentioned earlier too that our caregivers are going to be very heavily involved with this expansion of the vaccination campaign. Can you give us a little bit more specifics on what exactly our caregivers will be doing for this?
Sure. So, it's a great team of people that are working to make this happen. There's planning. There, in terms of what caregivers are doing, our IT teams are working hard on the digital workflows that accompany the person-to-person workflows so that people are well supported and that it's as easy as it can be from a process perspective. We have nurses and medical assistants and physicians and really everybody just raising their hands saying, hey, I can help out at this clinic site for this shift. We'll replicate what we did earlier in the year, and we'll have people helping with the flow. We'll have people giving shots. We'll have people watching everyone who's gotten a shot afterwards, make sure they don't have any reactions, and supporting them and answering their questions. So it's a team effort for sure.
And I feel like it's really important to note too, we've been doing stuff like this with testing. A lot of our caregivers have been very heavily involved with COVID-19 testing. And I know the logistics of this is different, but it does prep someone for the ability to kind of handle these mass vaccination clinics. They've kind of had the experience for the last year of what the flow needs to be like. And I think that will definitely help our caregivers as we move into this, which is exciting. And along that same lines too, so you mentioned that we're going to be helping with these clinics and kind of where they are. Do you feel like there could be even more clinics offered if the dosage availability increases, or are we kind of set in stone of how many we can offer through the state?
The answer is yes, there will be more sites. So it's really great to see the planning within the coalition. So they're managing what's needed today. They're thinking about and planning for what's needed in the coming weeks, and they're thinking about what are the needs going to be kind of late spring, early summer, and assuming that vaccine supply continues to increase as expected. I think everyone can expect that there at some point this will get to physician offices. So just like people get their flu vaccine, year over year, we will reach a point where we have broad availability, multiple locations. You can get it at the pharmacy, you can get it at your physician's office, you can get the local health district and local health departments. And this will just become part of the annual process of the things we do to stay healthy.
Someone also was curious about who is in this coalition of providers that is kind of making these plans and the decisions.
Sure. So first of all, Utah Department of Health is leading the coalition and I think doing a really good job of planning and coordinating. We're part of the coalition. The University of Utah is part of the coalition. Revere Health, which is a multi-specialty clinic across the state's part of the coalition, as well as Nomi Health, and of course, local health districts who have been doing this now since January.
So it seems like a team effort. We're all kind of hoping for the same outcome for this. We'd like to get vaccines to as many people as possible. My next question around that is our caregivers. So I know that our caregivers were given the opportunity to get the vaccine in that first wave of people as healthcare workers. What is the percentage of our employees that have actually received the vaccine to date?
So Amanda, 65% of Intermountain caregivers have received the first dose, and we're over 52% that have received the second dose. So a good response, very consistent with what people said they would do when national surveys occurred, with state surveys, and even our own internal surveys. So we feel good about the number of caregivers who have gotten vaccinated, and we'll continue to support them with making sure that there is access to vaccine when they decide the time is right for them to move forward and start the vaccination series.
And along those lines too, I know that everything we're doing in a patient care setting, we think about safety really heavily. What does this vaccine mean in terms of safety for our patients who come into our clinics and hospitals?
Well, I think it means the same thing as a whooping cough vaccine or a hepatitis B vaccine or a chickenpox vaccine, and so on and so on. We work very hard to make sure that patients and caregivers are safe when they are in our hospitals and facilities. We apply all the best practices when it comes to infection control. Uh, this is just, it's part of what we do every day. We're proud of our performance in this area, and I think people can count on us to continue to focus, because safety, we start everything with safety.
I know that when I walk into a clinic, I definitely feel very safe. There's hand sanitizer when you walk in. There's typically a greeter asking you why you're there. And it's really nice to see that as an employee and also as a patient, it doesn't matter who you are. The care is going to be the same for you when you walk in, which is great. Last question for you. These max vaccination clinics, how are they being funded? And do the actual vaccinations cost anything for you as well?
So there are different models of funding that are part of this, and I don't know if the detail there is probably way into the weeds. I think everyone feels confident about the fact that this is a sustainable way to do it. Something needs to be sustainable for organizations. It also needs to be affordable for the community. So, we focus on those things, and we'll be sure that we can provide this service, this really important part of addressing the pandemic, to our patients and to the broader community.
Well, Mark, thank you so much for joining us. I really appreciate it. Is there any last words you'd like to tell us around the vaccination clinics or efforts or anything else related to COVID-19?
I just want to come back to what an important moment in time this is. This has happened at such a remarkable pace. We're also still learning so much each and every day. We learn things from the vaccine manufacturers about the effectiveness of their vaccines, first dose and second dose. We learn things with every clinic and every test that we provide, and use that learning to keep improving so that people have great experiences when they need to get a test, need to be vaccinated, and really just need any type of healthcare assistance. So I feel great about being at this point. I hope everyone else does as well. There's work to be done, and we're rolling up our sleeves. We're going to work together, and we will come through this and get to that new future.
I think that's a great place to end, Mark. I really appreciate your time. And if you have any questions around COVID-19 vaccinations or eligibility, we'll put the link to that below, but it's on the Utah State's website. We also still do have our Utah Valley Clinic available today to anyone who is eligible, which is 70 plus, as well as K through 12 educators and healthcare workers who have not received their vaccine. I will also put the link to how to find out about that in the chat afterwards as well. If you would like to get tested for COVID-19, you can go to intermountain.com/COVID testing. You'll fill out a quick survey, and then you can pick an appointment arrival time to do that. We also have our emotional health relief hotline available still for the community. It's a free service of support for you. That phone number is 833-442-2211. Thanks, and we'll talk to you next time.